Any severely injured person will develop shock. Shock comes principally because of a depression in circulation and an eventual fall in blood pressure. As the shock deepens, the pulse increases in speed and becomes weaker. Irregular breathing and cold, moist skin are symptoms of shock. If the patient is lying on a cold or a damp floor or the ground, put woolen or some other material under him. First aid for shock is to conserve the body heat of the patient and keep him warm but not hot. Use great care not to move the patient unnecessarily. Notice how the blanket is pulled against the long axis of the victim's body. Do not use heated objects to warm a person who is suffering from shock. His sensations are not normal and it is easy to burn him. Always have someone call a doctor. When serious shock seems probable, raise the lower extremities several inches and maintain this elevation. Be reassuring and give your patient the impression that competent, sympathetic hands are doing all that can be done while awaiting the doctor. When bleeding from a wound is severe, elevate the wounded part of the body if possible. Do not touch the wound with the hand or clean material. Think first of pressure. Use a thick layer of sterile gauze or a folded, freshly laundered handkerchief and apply firm pressure with your hand. Bandage the gauze in place. If this treatment does not stop the bleeding, then a tourniquet is necessary. Apply the tourniquet above the wound, allowing a reasonable skin area between it and the wound. Wrap the material twice around the limb and tie a half knot. Place a short stick or something similar on the half knot and tie a square knot over it. Twist the stick just enough to stop the flow of blood completely. Call a physician as soon as possible. And keep the victim quiet. These lines indicate the pathways of the arteries we need to consider in first aid. At 6 principal points, these main arteries lie close to the bones. These are the points where digital or finger pressure on the artery and against a bone may stop bleeding. These points are called pressure points. Occasionally, the application of digital or finger pressure at one of these pressure points is a helpful measure in case of hemorrhage. Here is the proper technique for applying pressure to each of these pressure points. Just in front of the ear against the skull. About an inch forward from the angle of the jaw, where a large branch crosses the jawbone. In the neck, at the side of the windpipe, against the backbone. Behind the inner end of the collarbone, down against the first rib. On the body side of the upper arm, halfway between the shoulder and elbow. In the mid-groin, where the artery passes over the pelvic bone. Remember, always apply the pressure between the injury and the heart for arterial bleeding. The first rule in artificial respiration is to start treatment immediately. To revive infants and small children, mouth-to-mouth artificial respiration is recommended. Tilt the head back to keep the air passage open. Take air in your mouth and force it into the victim's mouth until the chest rises. Then allow the lungs to empty. Be sure to cover the victim's mouth and nose with your mouth. Apply a continuous pressure to prevent the victim's stomach from filling with air. Repeat the cycle about 20 times a minute until normal breathing is restored. The mouth-to-mouth technique can be used effectively on persons of all ages. When used on an older victim, the chin must be held up and forward to keep the airway open, and the nose must be held closed. An alternate way to give artificial respiration is the back pressure arm lift method. Lay the victim on his stomach, bend his elbows, and place his hands one on the other. Keep his head upright, placing his chin on his hands. Place the heels of your hands on an imaginary line running across the shoulders below the armpits. Your thumbs should just touch, and your fingers spread downward and outward. With arms held straight, swing forward slowly so that the weight of your body is gradually brought to bear on the victim. As you rock backwards, do not bend your elbows. Notice that the arm grasp is just above the elbow. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Always summon a physician as soon as possible and treat for shock. Check the mouth for obstructions. Don't give up. Continue artificial respiration until natural breathing is restored. A fracture is a break in a bone. Where a fracture is suspected, call a doctor. While waiting for the doctor, splint and prepare the patient for transportation. Place the arm in a normal position. A magazine or newspaper will make a good improvised splint. Be sure it is long enough to extend beyond the joint above and below the fractured bone, and that it is as wide as the limb. Tie the splint securely, but not tight enough to cut off circulation of the blood. All extensive burns should be regarded as open wounds with shock and infection as hazards. The same general pattern should be applied to all burns. Give the victim this first aid treatment. Gently remove loose, protruding bits of clothing in the burn, being very careful not to touch the tissue. After the burn is well exposed, place the dry pad or dressing over the burn so that it covers the area completely. Then bandage the dressing into place. Do the best possible job when applying a dressing, because the tendency in medical practice today is to change dressings infrequently. Wrap the bandage smoothly and evenly. For complete information about first aid, enroll in an American Red Cross first aid class in your community.